Okay, now let's proceed to the classification of film according to its use. So first we have mammographic film. Mammographic film is used for breast examination. We have a procedure called mammography which is used just for the breast. It is an X-ray examination of the breast. On a mammographic film, we use a single emulsion film to have a greater detail. Next is the therapy localization film that serves as a guideline. A therapy localization film have wide range of exposures and uses a direct exposure film, followed by dental x-ray film. When we say dental x-ray, we have two procedures. First is intraoral and next is extraoral. As I've said, intraoral is where the film is placed inside the mouth of the patient. What are the intraoral x-ray films? We have peripheral, the occlusal, and the bite-wing or interproximal. Intraoral films uses a direct exposure type of a film. Next is the extraoral film. Maybe some of you wear braces. Diba before we have braces, may mga procedures na kailangan gawin. First is the panoramic x-ray. So, the panoramic x-ray uses a screen film since it is extraoral. Okay? Next is the video film. Video film uses single emulsion and this can be seen in a multi-format camera or laser camera. Followed by photofluorographic film. Photofluorographic or also called as abiography. Abiography. Photofluorographic or also called abiography. It is discovered by Manuel Diaz Abiu. Photofluorographic uses a single emulsion type of a film. So this is also called the mini fluorography for chest x-ray examinations to determine the mass on a chest x-ray, APTB or the tuberculosis, pulmonary tuberculosis, and lung cancer. So photofluorographic or abiography is used for mini fluorography for chest x-ray examination, locating a mass on a chest x-ray, APTB, and lung cancer. This is a single emulsion type of a film. Next to photofluorographic is the cine or roll film. Cine or roll film is a single emulsion film. Single emulsion type of a film. These have sprocket holes. So kung maybe some of you have seen yung film nung sinauna, it has sprocket rolls para mapalagay natin dun sa iniikot sa mga sinihan, dun sa mismong viewing section. So that's the reason of the sprocket holes. So these are used for cardiac catheterization and usually yung mga cine or roll film is the angiographic film. Okay, next is spot film. Spot film are used for special procedures. A spot film can be used to determine an exact location of a mass on a certain part of the body. For example, the patient have undergo a chest PA X-ray examination. So there is a suspicious mass density on the left lower lung. Therefore, the doctor can request another procedure or another projection view on that certain part of the lungs of the patient. So therefore, we have to use as a rad tech a spot film just for that certain location. Next is copy or duplicating film, or what we also call the reversal film. This uses a single emulsion type of film and it uses UV lamp and light. Aside from UV lamp and light, we have to use black light bulb. So, copy duplicating film, kinokopya niya yung radiograph from the other film. So, this has two sides. The other side is lighter compared on the opposite. And the lighter side is placed directly on your light source. The more that you expose the film into the light, the lesser density it will have. So, baliktad siya on the usual radiograph processing natin. Diba kapag sa usual radiograph processing, the more we expose the film into light and into the processing chemicals, the more density it will add on the image. This copy or duplicating film naman, the more time we expose it to the light, the less density it will add on the film. Because this is a reversal. Okay, reversal. So, kung ano yung color na makikita natin on the original radiograph, when we copy or when we duplicate this using this type of film, the image will be seen in a reversed color. Or parang magne-negative yung color niya. Next to copy or duplicating film, we have dosimeter or the personnel monitoring film. So, this will measure radiation absorbed dose to the radiographer. Usually, ang ginagamitan ng film when it comes to personal monitoring devices is the TLD or the thermoluminescence device. It will measure the radiation absorbed dose of the radiographer. Last is the laser film. Laser film can be seen on a facility that have a CR system and a DR system, because CR system and DR system uses a laser printer. The film can be printed out, or the radiograph can be printed out on this laser film without the use of processing chemicals. There is no dark room. There is no fixer and developer solution in this type of film. It uses infrared light. Okay? So, those are the classification of films according to use. Now, let's proceed to the film construction. So, radiographic film has two parts. First is the base, next is the emulsion. So, now let's proceed to the base first. Okay, so base have a thickness of 150 to 300 micrometers. So, it is the foundation of the radiographic film. Its primary purpose is to provide a rigid structure onto which the emulsion can be coated. It should be flexible and fracture resistant. Should be semi-rigid, lucent, and made of polyester. And it should have a dimensional stability. When we say dimensional stability, it is the property of the base that will maintain its size and shape during the use and processing, so it does not contribute to image distortion. So, dimensional stability, kahit i-process, kahit i-handle yung film, kahit mabasa yung film, its structure should be the same. Dapat hindi siya agad-agad mabali. Okay? Next is uniform lucency. Uniform lucency and is nearly transparent to light. The base should be nearly transparent to light. Kasi di ba we use a negatoscope to view the radiograph. So ang pangit naman di ba kung merong mga sides of our film na medyo opaque, hindi siya lucent. The light cannot pass through on that certain part. So as you can see, a radiograph or a film is tinted with blue tint or dyed with blue tint. The tinting of the film reduces eye strain and fatigue. So that's the reason why our films are tinted blue, to reduce the eye strain and fatigue. It also enhances the radiologist's diagnostic efficiency and accuracy. So, did you know that before polyester, there are other materials that is used as a base of our radiographic film? Let's see if meron tayong yan. These are the history of our film base. Before having the polyester, we have used the glass plate as an original radiographic film. So, dito nanggaling yung term na tinatawag na X-ray plate. It is literally a plate, glass plate. This is the first radiographic film that is used during World War I. So, since madaming na injured during World War I, the production of glass plate or yung dami ng glass plate cannot accommodate the patients. So, during World War I, it became largely unavailable. Therefore, nagkaroon sila ng substitute, which is the cellulose nitrate. Cellulose nitrate is flammable compared to the glass plate. So, nakita nila to during the 1920s up to early 1930s. So, cellulose nitrate, yung sumunod sa ating glass plate, and that is flammable. So, napansin nila ay mabilis masunog si cellulose nitrate. That's why we have the cellulose triacetate. So, cellulose triacetate, ginamit siya ng mga mid-1920s. Ito yung tinatawag nating safety base. Compared to cellulose nitrate, this is not flammable. But the properties are almost similar to cellulose nitrate. Kinaibahan niya lang, it is not flammable. So, syempre, mga tao kailangan mag-improve all throughout our lives, every day, all throughout of our lives, nag-i-improve yung mga bagay-bagay sa paligid natin. That's why we came up with the polyester. So, polyester is used on the early 1960s. This is more resistant to warping from age and is stronger than cellulose triacetate. So, its dimensional stability is superior. This is thinner compared to triacetate but as strong. That's why we have come up with polyester as the base of our modern film.